and hit record, and we will get started. So we have some great upcoming events for you all. We have health screenings, wellness classes, and programs that we would love for you to take part in. This is part of your employee benefit, and so we want you to know about these events. You can visit wellness.ua.edu to be able to sign up for newsletters and get firsthand information about what's going on with the wellness and work-life team. And so definitely look at the upcoming health screenings and classes and programs and see if you're able to participate. When you do, you're going to get different rewards and things. Of course, there's lots of goodies on site when you do the classes and sometimes the programs, but then you also can have qualifications for gift cards and many other good things that you'll want to take part in. So definitely check that out. So my name is Abby Horton. I am a registered nurse and I teach at the Capstone College of Nursing here at UA as an assistant professor. I'm a certified health and life coach, a wellbeing ambassador for the Honors College, and one of your wellness class educators. If you would like to put anything in the chat, you're welcome to if you have questions or concerns. And yes, y'all are all muted, so no worries about that. I do see that question in the chat. You all also have the option of putting questions in the Q&A in an anonymous note if you would like to do that as well. Sometimes I know we don't like to ask questions out loud. You also have my contact information here, abby.horton@ua.edu. If you ever need to reach out or you have a question or something that you want to follow up on, please do. We also really welcome your feedback. So thank y'all for joining us today. So our disclaimer is that this presentation is just for educational purposes only and doesn't constitute medical advice, although we do get more medical in this talk than some of our others. And if you have specific questions or health concerns, please do be sure to contact your healthcare provider, your medical doctor, your nurse practitioner, whoever follows your healthcare, because a lot of times we're talking in generalities in this talk, but you might have specific questions that if you have a medication or a prior health concern, then that's going to influence the answer. So we'll talk about general things that you can do. All right, so some things that we want to be able to do in this class in terms of our objectives and outcomes. We want to be able to identify healthy habits to reduce our cardiovascular risk factors. We want to understand the relationship between cholesterol and hypertension, one of my favorite things to talk about. We want to learn about the risk factors for high cholesterol and hypertension, and then talk about and identify healthy habits to reduce those things. So high cholesterol, hypertension, which is all going to lead to improved cardiovascular health. So cardiovascular disease is the world's #1 killer. And that's important to note. Not only is that the case for us in the US, but globally. And of course, other things sometimes do come at the forefront, like we've seen with the COVID-19 pandemic. But in terms of chronic health conditions, cardiovascular disease is the #1 killer. And that encompasses both heart disease and stroke. So heart attacks and stroke are a part of this cardiovascular disease statistic. And so you can look at CVD, which is short for cardiovascular disease, cancer, respiratory diseases, HIV, all of those things that tend to get talked about a little bit more in our healthcare system and in the news media all rank lower. And you can see with this graphic, this was done by the World Health Federation and World Heart Federation several years ago, pre-pandemic, as many as 18.6 million cases of death a year when you're looking at a global perspective. And so that is a lot of people, and that's affecting a lot of families and communities. We're going to talk about risk factors more later, but I do have this included here in terms of high blood pressure, high cholesterol, overweight, obesity. Those tend to go hand in hand when you're looking at risk factors for cardiovascular disease, but also air pollution. That has really been at the forefront of people's minds recently because of the natural disasters and kind of, human disasters that have happened. One of which would be the train derailment in Ohio, but we've also seen that with some of the manufacturing issues, both in Ohio again and Arizona. With the earthquakes that have happened, you can have air pollution. We see that in Turkey and Syria. And so many other examples. When we have tornadoes, specifically when we have hurricanes, and that brings in a lot of flooding, a lot of disruption that can cause air and environmental pollution. Physical inactivity, which we usually say is that we're sedentary, so that we're not doing more than just our daily movement in terms of, parking our cars and walking into work. We're not doing much more physical activity than that. Unhealthy diets, which we often hear us, refer to the standard American diet as the SAD diet, or the modern American diet as the MAD diet. Diabetes, tobacco, and that can be any nicotine or, substance like that. Maybe vapes, of course, would need to be added. Kidney disease, which goes hand in hand with the high blood pressure and high cholesterol and the obesity, and harmful use of alcohol and other illicit substances. So heart disease is, primarily thought of as being something that men encounter and experience, but women increasingly are showing signs of increased prevalence for cardiovascular disease, both heart disease and stroke. So heart disease and stroke cause the death of 1 in 3 women each year. And so while this talk is for anyone, no matter how you identify, whether you're male, female, or if you are non-binary, when we're talking about statistics, we have our statistics broken down typically into male, female categories. And so that is what we'll use today to be in alignment with the studies that we're referencing. But the American Heart Association has a Go Red for women. And so if you're on the call and you're not a female, just know that what we talk about today will highlight a lot of things for females, but it's going to be applicable to anybody on the call. So cardiovascular disease refers to the health of the heart and the blood vessels. And so there are a lot of risk factors for cardiovascular disease that I've mentioned, and I've listed them here for y'all. But what I want to really talk about is this notion of metabolic health and metabolic disease. There's also a new term that we use called metabolic syndrome, and that is where you have multiple risk factors that look at the risk factors we've already named and seen that this is a metabolic risk factor overall. And so metabolic health is something you're going to hear more and more about as we look at inflammation being the primary source, typically, of chronic health disease, even things like Alzheimer's, dementia, that sort of thing. Alzheimer's, I'll just make a note, is really related to cardiovascular health in that when we are looking worldwide, a lot of times cardiovascular disease is linked to Alzheimer's in the inflammation and the blood sugar connection. Some people actually have gone as far as to say that Alzheimer's is really diabetes type 3 because it has such a strong association and correlation with having high blood sugar prolonged. And so I watched a TED Talk over the weekend, and the physician said that in his 22 years of experience as a physician, he had never diagnosed Alzheimer's in someone who had not had diabetes or high blood sugar for at least 10 years. And so I think that that's important to note, that when you're making changes in your lifestyle for cardiovascular health, you're really making, a huge step toward improving your overall health. And I hope that that is encouraging to you. So the Go Red campaign, I know that a lot of times we talk about the Go Red for women, and we think that that just means that we're donning, our favorite red, shirt. And usually that's early in the month in February. Usually on a Friday is when we have the Go Red for Women campaign launch, and where we all wear red on that day. And so that's particularly important for me because my mom had a heart attack at 55, which is considered early onset heart disease. And I also have a heart condition, and most of my family members on both of my dad and my mom's side of the family have cardiovascular health issues. And so, it's particularly important to me personally, not just professionally, to be able to get this information out to folks. And so sometimes you can do everything right. And I say right in air quotes because, we're human. We're going to have moments where we don't, follow the exact plan we're supposed to. But the thing is you can do everything, quote unquote, right, and you can still end up with a heart attack or cardiovascular disease. But it's just that we want to mitigate your risk factors, and we want to help you choose healthy, lifestyle choices and be intentional about your health and wellness. Because that's really what matters. Consistently showing up and being healthy is more important than being perfect and doing everything, so to speak, right. So I am one of the people who probably came to the awareness of this later is that Go Red is actually an acronym. So it's get your numbers. So know your lab numbers, but also know your BMI, know all of those other factors that we can measure. Own your lifestyle. So that's really about having accountability. Realize your personal risk factors. And so we're going to name the general risk factors, but you may have, personal risk factors, and some of those may not be true for you. So for me, I've never used tobacco or nicotine products. And so that is a risk factor for heart or cardiovascular disease, but it's not my risk factor. And so knowing your individual risk factors are important, and sharing those with your provider is really important. Educating yourself and also educating others, so that, when you learn and to do healthier things and healthier choices, educating those around you really helps empower your community. And it's always easier to make healthier choices when the people around you are making healthier choices for most people. And then don't be silent. What you learn and know and share this information. So share this video out when it's available. Share with your coworker or family member today something that you learned. And I think that's so important. So Go Red for Women has a declaration, and it talks about why we go red for women. But again, we need to go red for everyone, because we know that most people in the US are going to be touched by cardiovascular disease. And so knowing how to be empowered and how to look for specific signs and symptoms that may only impact women is important. I'll share this example. My mom is a nurse and has been for 40 plus years. And so she's given me permission to share a little of her story. But when she was having her heart attack, she actually thought that she was having like a muscular issue, or maybe that she was having a gallbladder issue, because women typically do not present with the same signs and symptoms that a male person would, based on just anatomy and hormones and things like that. So when men have, heart attacks, they typically have weakness and shoulder and arm pain. And that's really characteristic. So you might see them clutching, their arm and saying that they feel like there's a weight on their chest. Usually they'll say that it feels like there's an elephant sitting on their chest, that they can't breathe. Women still will have that shortness of breath, but a lot of times they'll have pain that what they call radiates. So it might start at the front of the shoulder and go to the back of the shoulder, and to the back of the back itself. And so they might have more GI symptoms. So they might have GI discomfort. They might have a stomach ache. They might have nausea or vomiting or diarrhea. Those things are going to be different than what is a typical presentation for a heart attack in a male patient. And so it's important that we recognize those. Thankfully, one of my mom's best friends was with her at the time of her symptoms, and recognized that there was something a little more serious going on than maybe just that she was having a gallbladder attack, or that she was having a shoulder issue, and got her to the emergency room in time to go to the cath lab and eventually to having open heart surgery. They tried to place a stent first and then couldn't get that in for the second vessel that needed stenting, and so then she had open heart surgery, and that became a part of our family story. And so I always believe that you should share from your stories and from the painful moments of life, because it may help someone else. And so knowing those signs and symptoms that are more characteristic for women are helpful. I've listed a few for you. There are many more, and there's a lot of information on the American Heart Association site for y'all to look at. So I hope that's helpful. So now we're going to move into this is the class for everyone. All the information applies to everyone on the call. So cholesterol and hypertension. When we talk about cholesterol is a type of fat that is going to be in your blood, and that has a number of important functions. And so y'all know I talk a lot about stress if you've attended my other classes. Well, when we talk about stress like we shouldn't have any, we also talk about cholesterol as if we shouldn't have any cholesterol. And we really make cholesterol be kind of villainized and say, oh, your cholesterol is high, that's not good, let's put you on a statin. And that may be appropriate for you. Nothing that I share today is to discourage you or to change something that you're doing with your provider, because they know your health best. So back to that disclaimer. But here's the thing. When your cholesterol is high, your cholesterol is really instrumental in helping with inflammation. So your cholesterol will go in when there is a problem in your blood vessel. That inflammation happens to help bring in helpers to repair that inflammation or to repair that damage. And cholesterol plays a vital role in that. It's not the only role of cholesterol, but it's one of the most important. So if you have a lot going on in your blood vessels and your circulatory system, and your cholesterol is high, it's likely because there's inflammation that's not being taken care of. So inflammation is meant to be there for like an acute, like an immediate injury, but it's not meant to be high chronically or long term. And so when you start having a lot of challenges with your health, you notice that your inflammation markers, and there's a lot of them, C-reactive protein, SED rate, there's tons that you can look at in terms of that. Even your ferritin levels can speak to your inflammation. All of those things start to kind of pop up on your blood work, and you start to have signs and symptoms. And we don't sometimes recognize that cholesterol is just a red flag of there's a problem that your body, your inflammatory process is designed to kind of correct and repair, and it can't do that for some reason. Or maybe it can't do it to the extent that it takes care of it totally. So high cholesterol, it's important to note we ingest, so we eat foods that have, cholesterol in them that, contribute, but we also have cholesterol that is produced by our liver. And so about 75% of our cholesterol is produced by your liver, and about 25% comes from what you eat. And so we really usually, when we're talking to patients in patient education, we usually really only talk about that 25% that you're eating. But you also want to take a look at your liver and make sure that you're not having issues with your liver, that you're not, having challenges there, because again, that's really the bulk of where your cholesterol may be elevated. It's not broken down as clearly as that, because those numbers are going to fluctuate. But you have to do more than just change your diet. You also have to look at and support your liver health. And so again, when we think about people who have cardiovascular disease, events like, heart attacks, or what we call myocardial infarctions, or when we have things like, strokes, when we see that the cholesterol is high, sometimes we blame the cholesterol and say, oh, well, they had high cholesterol, so that's why they had this event. And what we're seeing, physicians and surgeons and people who study this, are really noting that cholesterol is just there. That would be like attributing ambulances at wrecks as being the problem. And so like every time you see a wreck that's pretty severe, hopefully you're going to see at some point an ambulance that's there. And the ambulance is there because they're trying to get there to be a helper, to help the situation at the scene. That's how cholesterol is. Cholesterol is at the scene of the heart attack, of the stroke, all of that. But it's there really to be a helper. And that's not to say that cholesterol being high is okay. It isn't. It just means that you have to approach that from a different perspective than just trying to lower the cholesterol without doing the other considerations. And so if you have high cholesterol, talk to your healthcare provider about the best approach, and maybe share some of the information with them so that y'all can have a good game plan for you in particular. So some things that you need to start doing. I always think it's easier to add in good habits than it is to subtract. And so we always start with the things that you should stop. So stop using, cigarettes and tobacco and nicotine. Stop drinking, soft drinks. Stop doing, the things that you're doing. But really, I think that it's easier for you to add in things. So instead of saying, I'm not going to drink any more Cokes, it's a lot easier to say, I'm going to drink my Coke because that's a habit that I'm going to have to address, but I can add in another water. I think that's really important to start with the additions. And then once you add in more things, it's going to get much easier for you to take things away. And those are going to be the things that probably are helping you with your dopamine, that are probably giving you that energy boost. And so if you take all of those things away at one time, that can really lead to kind of a shock to your body. So work with your healthcare provider, your MD, your physician's associate, your nurse practitioner, maybe your registered dietitian, your wellness coach, whoever's on your team. And maybe it's a mental health counselor plus all of those folks. Have a healthcare team of people that you can rely on and trust, and then walk through what your plan would look like of how you're going to make those choices. So obviously we want to eliminate as much as we can. We want to add in good fruits and vegetables. We want to add in more water. particularly water that has electrolytes and minerals in there. And we can suggest some packets that may be helpful in terms of adding those things into your diet. Moving your body more, that does not mean to go out and, join Orange Theory, today if you've not been exercising. That means going and getting a checkup, getting cleared by your healthcare provider to start exercise, and start with walking. For us, most of us just need to walk more before we add in anything else. And I see that there's a hand raised. Miranda, I don't know if you can help me with that. And it may be that you want to just, if you can unmute, but if you want to, you can also type it in the chat or the Q&A, and I'll take a look. So you just want to make sure that you're moving your body. Walking or swimming, I think, are two of the best exercises. Swimming is only better than walking because it helps people who don't have a lot of stamina and who need to have non-weight bearing exercise, but walking is definitely more accessible for most people. So just keep that in mind. Monitor your weight, but know that the BMI is not, the end all be all gold standard. It's just one metric. And so if your BMI is still high, and you've worked and you've lost weight, it's going to take a good amount of weight loss for your BMI to move. For y'all, I try to share personal stories because I think that's what motivates and inspires people. It motivates and inspires me on my health journey, which I'm always on a health journey. For me, part of my wellness journey is about losing weight. I've lost a little over 80 pounds in the last, 3 or so years. And my BMI, even though I think if most people were to look at me, they would assume that I have a healthy BMI. My BMI is still elevated, even though I've lost that amount of weight. And part of that is bone structure and muscle mass. I have a lot more muscle mass than the average person of my age and of my gender. And so there are a lot of things that you have to take into account. So BMI is important to monitor, but it's also important that you know your waist circumference. How big is your waist? The more adipose tissue, or what we call fat tissue, that's in our core area, so that's in kind of the trunk of our body, the more concerning that can be, because that's going to have more what we call visceral fat surrounding those organs or putting pressure on those organs. And so if you carry your weight in your abdomen and your trunk or your core like I do, that's going to increase your risk factors a little bit. But we're going to really focus on how we can control what we can control. So if you're on medications, take those as prescribed. If you're on a weight loss journey, continue on that, and know that you need to focus on just 1 or 2 pounds at a time and making healthy choices, because the weight, the scale, that's going to fluctuate every day. And that's okay. That's expected. For women, people who have a lot of estrogen and progesterone on board, your weight is probably going to fluctuate a little bit more than someone who primarily is running off testosterone. And that's just part of it, because our hormones are done in a monthly cycle, whereas men have more of a cyclical daily cycle. And so that can be frustrating when you're on a weight loss journey, but just know that that's expected. Blood pressure. When you think about blood pressure, cholesterol and blood pressure go hand in hand. A lot of times people will say, oh, we looked at your labs and we noticed that you have high blood pressure and you also just happen to have high cholesterol. Well, when you're looking at one and you have high cholesterol or high blood pressure, you need to go see if the other is also high, because usually they are, and it's not a coincidence. It's because most of the time your blood pressure is high because you do have either a hormonal reaction going on. There's some other kind of nuanced things that can happen with your blood pressure, with your heart and your brain and your hormones. But for a lot of people, when we're thinking about cardiovascular health, their blood pressure is high because the cholesterol is high, and it's causing some blockages within the vessels that's causing the blood pressure to have to increase to get where it's going. And so we're going to use an example of like a water hose out in your yard to kind of make that make sense. So as you're getting corrosion in your water hose, your garden hose, and you turn it on for the first time, we're starting to get really beautiful weather here. So you turn your garden hose on and it feels like it's hard to get the water out, and you've got it going, full blast. So full blast, you're turning that valve, that gauge, that's your heart. And so you're turning that on and you're not getting enough output. You're like, where's the water? It's probably because there's some corrosion, or there may be maybe there's a kink in the hose. There's a kind of a knot and you can't get the water out. Well, that's what happens to our blood vessels. When we get that extra cholesterol deposits in our blood, it starts to build up like that corrosion would in your garden hose. And you've got to be able to make that flow to get your blood pressure to lower back to the normal range. And so that is demonstrated here and illustrated in this yellow of the blood vessel. And so you can see that you start to get what we call an occlusion or blockage from the top and to the bottom. And then this little red dot here is supposed to really, kind of depict a red blood cell trying to go through. And that's where you can get blood clots and have what we call plaques and other buildup there. So with your blood pressure, you know that there is a lot going on, and the choices that you make really help with both cholesterol and with blood pressure. So for heart and for your brain. And so make sure that we say blood pressure is a silent killer. I really think that that's a misnomer, and we should say that cholesterol is the silent killer, because cholesterol really truly doesn't have any signs and symptoms. When you have high blood pressure, you're going to start to have eye pain and pressure. You're going to start to have headaches. You're going to start to feel fatigue and really just feel kind of run down and sick. And so to me, initially, yes, your blood pressure when it's high, it is silent because you don't have a lot of symptoms. But I really think we need to start looking at cholesterol as being the silent killer here. And so I know that this is not, the most positive language in terms of saying killer and all of that, but that is how we're talking about it in medicine. And I think we're going to see that that changes over time, because we do have a lot more choice and control than we give ourselves credit for. And so I hope that that is an inspiring part of this talk today. So cholesterol isn't bad, like I mentioned. It's mainly composed of fat, or that adipose tissue, and lipoproteins. And the lipoprotein is going to be comprised of, so kind of, we're adding it all together, your cholesterol, your protein that you get in your diet, and the fat or triglycerides that we sometimes measure when we do a complete panel and look at all of your blood vessels and your blood components and things. So we often talk about LDL, and it's depicted here as a devil. And again, that's very common in healthcare. And it's what we learned it in nursing school as is lousy DL. So like, it's not the good one. Your LDL is not the good one. And that HDL is, depicted here as an angel, of course, and it's the healthy DL. So HDL, LDL, one's good, one's bad. That's how our language is. But both are needed. So I think this is helpful when you're learning the difference between the two. But really, the thing is that you need both. And we're going to talk more about that. And then, of course, here's your red blood cell. So cholesterol is naturally found in the foods that we eat and also in our bodies because our liver makes it, because it is essential. So we have to have cholesterol on board. We just want it to be in the healthier ranges. And every cell in our body requires cholesterol to function. It's needed for hormone synthesis, it's needed for vitamin D production and the use of vitamin D, and it's needed for a lot of other normal body functions every single minute of the day. So when we think about cholesterol, it's a soft, fatty-like, waxy substance. So it's really sticky. And that's the problem, is when it gets in those vessels and it gets stuck, it's very sticky. And that's what causes the clumping of the blood vessels, the blood cells, the red blood cells that are going by. It gets kind of snagged on that cholesterol. But again, it's normal and it's a healthy aspect of your body and your health. And so we need to look at our meat consumption and our dairy products. A lot of folks are really sensitive to dairy, even, conventional or raw dairy products. And so knowing that about yourself is helpful to know. I do think that meat is a healthy component of one's diet, but I respect that not everyone does eat meat. But I do think that, most things in moderation is my approach to nutrition. And so I do think that meat, specifically that you're having complete proteins, which you can achieve that with a non-meat diet. But I definitely think you have to make sure that you're more intentional about your protein and having complete proteins. We have some great registered dietitians and nutritionists on staff here at the University of Alabama. So if you want to make an appointment, we'll share some information at the end of the presentation about that. I personally am a life coach and a registered nurse, and I have several times throughout my wellness journey gone and made an appointment with our RDNs to check in, and because it's often easier and better for you to get an outside perspective, just to have someone else to kind of, have another set of eyes look at what you're doing to make sure you're on track. Your body needs that cholesterol to work properly. And so you want to make sure that you have a good balance. If you are on medication or you are lowering your cholesterol, that's being monitored so that you're not impairing the essential functions. So the HDL, the LDL, and the triglycerides we just mentioned, and that's abbreviated for high density lipoproteins and low density. So not lousy and not healthy, but that helps a lot of medical students and nursing students and RDN students learn how to differentiate the two. So we're going to talk a little bit about Pac-Man here. And so you've got your liver, and it's making about 75% of your cholesterol, and it goes out as LDLs. So I say LDL, it's, we're doing a lot of acronyms, and that helps me learn too, but your LDL is leaving your liver. So lots of play on words with alliteration there. And it's carrying cholesterol to your cells, to your blood, to your cells. Well, it gets into your blood vessel here, your artery, which is a type of blood vessel, and it becomes, kind of engaged with this cholesterol deposit, which we call a plaque, right? And plaques are often depicted and talked about as they are pimples popping. And so this plaque, when it builds up and there gets to be a lot of pressure because the heart's trying to get blood to where it needs to go. It's trying to get blood to the periphery, so out to your toes, it's trying to get blood to where it needs to be and then back to the brain, because the brain loves blood and loves oxygen because the oxygen's being carried in this blood. And so it's hungry for that. So it's trying to get it back. So your heart will be like that valve on the hose trying to get as much blood out because it's having a hard time getting there and getting back in the time it needs to. So eventually that pressure builds up on the plaque, the cholesterol deposit, and it pops like a pimple. And that is what will sometimes pop the blood vessels, where you have, a collapsed artery or vessel, or where you have a blood clot that, ruptures. That's what's usually happening. That's not all cases, but that's what we're kind of, wanting to talk about here. When that doesn't happen, though, and the buildup still keeps coming, you see the cholesterol still coming from the LDL, the red blood cells are still coming in. Then you've got all this LDL that's going back out, and it's the HDL, or what I like to call, we said healthy, I like to call them helpers. The helper HDLs are the Pac-Men. They go in and they eat up the extra LDL. And so it's removing the excess cholesterol from the bloodstream to get it back to the liver to be recycled. And so here's the issue is when you have the LDL and the HDL, a lot of times if you're eating too much that has LDL in it in your food, and your liver is kind of under stress because it's like, oh, we need some extra cholesterol out there because there's a lot of inflammation we've got to clean up. We need to send out some more workers. The problem is that the helpers, helpers are always few and far between, right? Same thing in your body. There are fewer of these than there are of the LDL. And so we talk about an HDL to LDL ratio. So when the ratio gets out of balance, there's always more LDL than HDL typically. But you can increase your helpers by doing things like, eating more protein, having more antioxidants in your diet, things like blueberries, having, some omega-3s. Omega-3s can be helpful. So those are ways that you can increase it, exercise, many, many ways. There's lots of things that you can do here, and you can go to the American Heart Association and look at that. Well, when we have the ratio and it gets too out of balance, then what happens is that we don't have enough people getting that extra cholesterol out of the bloodstream, and that keeps forming the deposits. And so that's why the HDL and LDL ratio is so important. And while you want to see that you have more helpers. So that's a really good thing. They are hard to increase, though. It's a lot easier sometimes to lower your LDL than it is to increase your HDL. So I hope that's helpful. I know for me, I wish I had learned it that way because it makes more sense in that visual scenario. So your triglycerides then are going to be this fat that's stored in your body. And so when your triglycerides are high, the reason that's so concerning is because it means that you're probably storing a lot of extra fat or adipose tissue on your body. And usually for a lot of people, especially those who have cardiovascular risk factors, it's going to around the abdominal area, or what we call the trunk, the core. And it's going to where it's layering over those organs. putting that extra pressure on them. And that's when you can start to have signs and symptoms and other diseases pop up. So things that you're going to want to be mindful of. Any fats that are coming into your diet, you want them to be fats that are healthy fats. We'll talk about what that looks like. But I'm not going to vilify, butter. I would rather my family members, and I'm just going to talk about me and my family, I would rather see me and my kids eat regular butter in moderation than to eat all of the like margarine and butter like substances that you can get, free reign. And so we don't use fat-free products in our house because usually those have extra additives and chemicals. We don't use butter substitutes or sugar substitutes or things like that. We use everything in moderation. And we find better sources of sugar than just plain cane sugar. And so that's something that you want to consider. Avocados are really good. You can get some nut butters that are really healthy and that have good fat. And so again, it's not just about adding in, the things that are healthy. It's also adding those in while you're looking at other things you can sub out. And so let's look at the fat-free. Again, they're going to have a lot of chemicals and additives that may be, playing with your blood sugar, maybe causing you other things to happen that you're not even aware of, like fatigue, that sort of thing. So not just that we're counting calories, but that we're also counting chemicals is super important, not just for weight loss, but for wellness. And so calories that you eat are important, but also you've got to look at, how much are you storing in that and why are you storing? When we store fat, there's a lot that can be going on there. It can be hormonal. It also could be a protective mechanism. If you're exposed to a lot of toxins or environmentally or in products or in the foods that you're eating, our body's way of protecting us is to store it in fat. So when we get extra hormones, extra chemicals, extra toxins that are coming into our body, whether it's in the way that we're breathing it in, or whether it's we're eating it and drinking it, or whether we're putting it on our skin, there's so many products that have, tons and tons of chemicals. I think the average person before 8 a.m., there's a statistic that says that you have used products just getting ready in the morning that have had more than 300 chemicals in them. So if you're having that much exposure, then sometimes your body, if it can't compensate and there's a lot of inflammation going on, it will store those toxins and chemicals that you're being exposed to in the fat tissue. And that's why it's so important, if you have extra weight to lose, to check in with your healthcare provider first, because you're going to need to really increase your movement. You're going to really need to increase your water, and you're going to need to make sure that your drainage pathways are open. You're crying your tears, you're sweating from the places that you should be sweating from, that you're having, daily bowel movements so that you can get those toxins out. Because when you start to lose weight, it's going to release those toxins that are in those fat cells. And we call it the swoosh effect or the whoosh effect, where those cells collapse and suddenly you have a weight loss after, a period of, kind of being on a plateau, but then you can sometimes feel a little sick or kind of like you have the flu, something similar to like what people describe as the keto flu, when they're kind of getting off all this processed, food and things and the sugar and the caffeine. Your body knows how to protect itself, and one way to do that is to store extra fat. And that certainly was a part of my journey. I had a lot of toxin exposure as a child and through my formative years and early development. And so when I started losing weight, I didn't feel great. People said, "You're going to feel wonderful. Your life's going to be totally different." And it does have its benefits for sure. And I'm glad I did it. It's great for my health. But in the process of losing that weight, it wasn't fun. And I did feel sick a lot because I had to make sure that I was actually getting those toxins out. Sweating, drinking water, having daily bowel movements are all really good ways to get that extra stuff that doesn't belong in our bodies out. And then, your body needs energy. And so when it needs energy, it's going to release your triglycerides. So if you have a surgery, if you have an accident, an injury, if you are putting your body through a lot of stress, maybe you are going to high intensity CrossFit style or Orange Theory style workouts, or maybe you're signing up for a marathon or something like that. Your body is going to release those things, your blood sugar, your triglycerides, your ferritin, all of those things that's being stored to give you that energy that you need to get through that stressful event. And so exercise is amazing and we need to do it, but we need to be really intentional about doing it. And that we start slow and that we do it to the kind of the graduated introduction of exercise, not that we go, from our couch to doing a full-on workout at the level that everyone else in the class is. And then we sometimes expect that of ourselves. So here are the triglyceride normal value ranges, and that's just here for your reference. And when we look at this, levels above 150 include a risk for heart disease, but also put you at risk for metabolic syndrome, which we've mentioned a little bit about that. So we want your normal to be less than 150 mgs per DL. So that's your reference range. So types of fat. When we think about types of fat, you've got trans fat, unsaturated fats, and saturated fats. So trans fats are naturally occurring in artificial food preservatives in fried and baked foods, processed foods, and it triggers your liver to make extra cholesterol. Unsaturated fats are considered to be more healthy fats, things like salmon, avocado, almonds, walnuts, olive oil, flaxseed. Those are the kinds of fats that you want to be adding in. And then you also have saturated fats, where we try to avoid those as much as we can. And those are going to be things from like animal fats and dairy, and that's going to trigger extra cholesterol as well. And so with the trans fats, you just want to make note that on your package, when you're reading through the nutrition label and it has trans fats, you really want to see 0 trans fats there, because it means that we have put in a human-made chemical, food preservative, food additive, or something that we've done to alter that food. And we call it a trans fat, but it's really more like a chemical. And so try to make sure that those things that you're eating are actually a trans fat of 0. So again, this is some things that we've touched on previously, but the reason I like to include this slide is it talks about the formula of total cholesterol is your LDL cholesterol plus your HDL cholesterol plus your triglycerides after they've been divided by 5. And so that's how you get your total cholesterol number. And when we look at total cholesterol numbers, a lot of times we're looking at cholesterol levels for adults. It may be broken down by age, or it may be broken down by gender, or it may be broken down by both. And so when we look at that, ideally you want your total cholesterol to be less than 200. But here's the deal. If you have LDLs within normal limits, so we want your LDLs to be less than 100, and we want your HDL to be greater than 60. We want your triglycerides to be less than 150. In theory, you could have a higher cholesterol if you have a really good and high density lipoprotein HDL number. Your LDLs could, in theory, be pretty low, and you could have a higher total cholesterol just because of the HDL. So when someone tells you your total cholesterol numbers, you want to ask them, can they tell you what the breakdown of LDL, HDL, and triglycerides is? Because that's going to be even more important to helping you decide what it is you need to do. I hope that helps. Y'all let me know in the chat if this is helping y'all. I don't want to get too technical, but I think breaking it down in this way gives you some context for why this is so important. So the downside of too much cholesterol we've touched on, but it really is impacting your vessels, your arteries, and all of that, your blood vessels. And we know when we have that extra cholesterol in the arteries, it makes them less flexible, so they're more likely to break. And y'all know that from your garden hose. A lot of us are going to go out into our gardens in a couple of weeks when we're on spring break and realize that the corrosion in our garden hose has made it kind of brittle and break because we've kind of left it out in the elements. Same thing with our arteries and our vessels. They get brittle and break because they're not as flexible because it's got corrosion or cholesterol in there. So you've got the hypercholesterolemia and atherosclerosis, heart disease, heart attack, and stroke. And so this is high cholesterol, kind of a wearing down, kind of sclerosis, or like that less flexible artery situation going on with atherosclerosis, heart disease, heart attack, and stroke. And so it's important that there really are no signs and symptoms of your high cholesterol. And so that, again, is when we say that it's silent, or why I think we should call it that. So concerns could be heart attack and stroke, but also poor circulation and high blood pressure. So you could have things like neuropathy. And this is why it's so difficult to know when you're looking at a person who has metabolic syndrome. Maybe they have diabetes and heart issues, or stroke or dementia issues. These symptoms all overlap, and that is why they created the metabolic syndrome term to encompass all of that. So again, looking at a normal artery, we're having a different view of it. the initial stage of this atherosclerosis, or like the narrowing of the artery is what we call it, is the beginning of a cholesterol plaque. And then this is considered advanced, so significant atherosclerosis. And then the last stage is complete. And what I always want to note here is that you can see that a complete blockage, when we say that an artery is completely blocked, it's about 80% blocked usually. So a complete blockage, in my mind, I always thought, oh, well, that's 100%, that's complete. No, a complete blockage would be about 80%, which is what you see here. And so when you have those complete blockages, that's when you usually cannot put a stent in, which is what happened with my mom. She got one stent in, but couldn't get the second one in the cath lab because she had this blockage. So that's important to note, because I think that changes how you look at your vessels and help. You don't have 100% to work with. You've got to make sure that when you're seeing the complete blockage, you know that that's only 80%, and that's still significant enough to cause, significant signs and symptoms and issues for you. So inflammation, when high levels of cholesterol happen in the bloodstream and you have that extra LDL and it starts to really take root in the vessel, then you have that inflammatory response that I talked about earlier. And then that turns into ongoing inflammation. And like I mentioned, the inflammatory process in the body is supposed to be a helper, like an ambulance that just gets sent out to help at the scene and come back in. And so when that stays on, then that's when you start to see a lot of issues. You can even have dysregulated nervous system responses. You can have, pain. You can have, GI issues, brain fog, so many things related to chronic inflammation. And so here are some warning signs of the atherosclerosis or clogged arteries. Most of these we've mentioned, but things like fatigue and dizziness, shortness of breath, chest pain, and it's usually a pain and a pressure, lower back pain, erectile dysfunction, because again, that's speaking to the blood vessel situation, and then painful, numb, or cold hands and feet, and that's looking at the neuropathy, which can be very similar to what you see in diabetes. So you can develop diabetic neuropathy. So the blood pressure we mentioned and talked about the hose and how that works. And so again, the heart is having to work overtime to get the blood out and to get the blood back. And so then you can start to see issues with the heart. And so again, you want to make sure that you're thinking about how you are going to manage this, not just from the perspective of medications, which are really important, but also that you're looking at lifestyle choices. For me, I started experiencing stroke level blood pressures in my mid 30s, about 4 or so years ago, maybe 4 to 5 years ago now. And I left clinical with my students. And when I left for the day, I knew that something wasn't quite right. I was having a lot of one-sided eye pain and pressure, and I had a really severe frontal headache. And so I had one of my students check my blood pressure. And I remember her saying at the time, I hadn't completed my doctorate. So she said, "Ms. Horton, I think that you're I think this must be wrong because this blood pressure is really high." And I said, "No, that's why I had you check it out. I bet that it's right." And so it was so high that I did get a colleague to double check it, and it was high. The student had correctly taken my blood pressure. And so I was grateful. So I called my primary doctor and went straight from there to my doctor's office. And I left with a prescription for blood pressure medication. And I stayed on that prescription for 4 years and under doctor supervision. After losing 80 pounds, after doing a lot of changes in my lifestyle, I was able to, under my doctor's supervision with his permission, wean off of that medication. And so medication was really helpful to me at that time to prevent me from having a stroke or heart attack. But what we often think is that when we get on medication that we have to stay on it forever. And sometimes we do. Sometimes that is a part of our story. But I always like to share my story because, after 4 years, I was ready to quit. I'm like, I'm never going to get off this medicine. But I persevered and I was able to get off. Again, some other people might persevere and it still may not be what works for them because there's a lot of factors at play. But I do always like to try to share hopeful and encouraging stories. Because if you can be off medication, that's great. But if you need it, that's also fine. So the systolic pressure, we talk about diastolic and systolic pressure. It's those numbers you see on the ratio where it's like 120/80. Well, when you're looking at it, systolic pressure is the measure between when the heart is contracting, so when it's working, and the diastolic pressure is when the heart and the actual valves are relaxed. So when we look at the numbers 120/80, when we're looking at the diastolic number, we're actually sometimes more concerned when that number is high, and that number is usually not as high as the top number, because that's when the heart's trying to rest and relax. And when that number is really high, it means that the heart isn't getting to like really relax. And so that's when you start to look at the numbers 120/80. When that bottom number is getting higher, it's still probably less than the top number that's high, but that's when we start to see more concern from a provider level, because that's knowing that the heart's not getting enough rest. And so I think that's an important thing to know about blood pressure. And this looks just at the pressure on the walls and how much pressure has to build up to be able to get through those damaged walls or plaque. These are the blood pressure categories. So now we really like to see that blood pressure is less than 120/80. So if you start to get, to like, 123, 124/, 82, 84, then you're going to see people start to recommend lifestyle changes about blood pressure. And you're like, well, that's really close to 120/80. But because these changes and vary so often, it's just kind of an average of your blood pressure. They really want to see that your blood pressure is even, a little less than 120/80. But when you're getting closer to, 100 and you're getting into the 70s, then you also can have some signs and symptoms from low blood pressure, because you don't have quite enough pressure to build that stamina and to not be weak and fatigued. So it's definitely a balancing act, and people are going to have very different tolerances to low blood pressure or to high blood pressure. So don't compare yourself to others. So here are some other recommendations. Again, it talks about healthy lifestyle choices, which we've mentioned, and it talks about the different ranges. I just think it's good to have different sources that show you the same information from a different perspective. So that's here. Miranda has the slides, and so she'll share those shortly. Hypertension symptoms, you can see here, this is high blood pressure, but it's hypertension, so it's the diagnosis of multiple high blood pressures. So here's the thing, any of us, all of us have high blood pressure at some point, because that's just how the body works. When you're leaving work today and you're in, 5 o'clock traffic, you're probably going to have high blood pressure, especially if you're trying to avoid a wreck or you're trying to merge with traffic. You're going to have high blood pressure. But if you have sustained high blood pressure over 3, separate times where you're checking that high blood pressure and it's pretty sustained, or even if you're what we call spiking to a high blood pressure, you may need some treatment or medication, and that healthcare provider can work with you on that, because you want to make sure that you're controlling for hypertension, which is the diagnosis of sustained high blood pressure. And so headache, shortness of breath, nosebleeds, flushing, dizziness, chest pain, irregular heartbeat, pounding sensation in your chest, neck, or ears, visual changes, so like blurry vision or double vision, blood in the urine, or fatigue and confusion, or just brain fog. So a diagnosis, again, because it does fluctuate, you're going to have 3 or more hypertensive readings, usually in a hospital or clinic setting, before diagnosis. So if you suspect that you're having these issues, you can use our blood pressure machines around campus. There's one at the Student Health Center. There's one on kind of the HR campus that you can use to be able to track that. Go to your local pharmacy or grocery store. And if you start to notice that you're getting multiple high blood pressure readings, then let your healthcare provider know, document that, just, put it in a notes app on your phone and let them check you so that you can have that diagnosis more quickly if that's a problem for you. And that's the thing, when we're only going to the healthcare provider once a year, it might take a couple of years before you're ever really diagnosed with high blood pressure. And then that's 3 years or 2 years that you're waiting when you could have been making changes. And so it's really good to be proactive. Health effects of high blood pressure, we've talked about many of these. Kidney disease and failure is also one that's important to note, and vision loss. And so again, you're going to want to take note of those. The impact of hypertension, this is just some stats about, how 1 in 3 adults are going to experience high blood pressure as a diagnosis or an ongoing issue in their lifetime. And in 1 in 3 already have hypertension, and may not know it. Most people, about half the people don't know it, and about half the people aren't well controlled, either with diet, lifestyle, or medication. Risk factors, the things that you can control, you need to control. So stress, smoking, substance use, obesity, diabetes, salt intake, overly processed diets, caffeine consumption, and other lifestyle factors, environmental exposures. Those are the things you want to focus on controlling. You can't control your family history or genetics. You can't control for, ethnicity or age or sex or those kinds of things. And those play factors into this, situation, but you want to control what you can. So treatment and medications, you can have anything from diuretics to beta blockers. Most people will start with hydrochlorothiazide, and that's what I took. And so that's, one that you often see people start on. And then diabetes, it talks about, over time, circulating glucose can really damage, and you're increasing your blood sugar, usually because you're eating the same foods that are causing the high cholesterol, but also your body will increase your blood sugar or your insulin to be able to give you energy to restore and to kind of address some of the inflammatory processes that are going on. So I'm going to go through these really quickly. Metabolic syndrome, it's the combination of high blood sugar, high blood pressure, high cholesterol, high triglycerides, and excess fat around the waist, and that is metabolic syndrome. And I definitely had that. So this is the holistic approach to health. And again, this is the toolkit that we're leaving you with of how to really approach this lifestyle. So controlling what you can control, 7 steps to a healthier heart. So again, most of this I've touched on, but I think it just works out to have a really good toolkit for you to start getting active. Pick one thing that you want to work on. The wellness basics, I always say that this is foundational to health. So control what you can control by, usually I say to start being more hydrated, because you can really control that. Sleep you can work on, but you can't always control the quality or even the quantity of sleep. Striving for a healthy plate, so a lot of good fruits and vegetables, but also good protein, meat if you eat it. Move your body every day, so 30 minutes, 4 to 5 times a week is going to be where I would suggest starting, and just a nice pace of a walk. Meditation or brain breaks, and really doing some deep breathing that can help reset your nervous system. And then I go through sleep, hydration, nourishment, movement, meditation, just some examples of those. This is the GLAD technique that I really like. So how to practice gratitude, something you're thankful for every day, something you've learned, something you've accomplished, something that delighted you or made you happy today. My delight when I'm teaching wellbeing classes, the wellbeing class is always my delight. So that always makes me feel good. Some other practical tips that you can use and implement, and then just some information about smoking, vaping, and tobacco use. Obviously, there is no recommended, levels of being safe to do these things, but I know it's hard to give up. We all have something that's hard to give up. Talking about exercise, again, the more vigorous cardiovascular exercise is going to be recommended, but it's not always the best option depending on your situation. And then I've mentioned body mass index, giving you some examples. The DASH diet's really important. A lot of times the supplements and the spices that they recommend, though, have a lot of additives and chemicals. So again, just you want to make note of that. Some information on food labels. So this is just a resource for you to reference. Some things that you can try, like turmeric or curcumin, omega-3s, more fiber, more plant-based options, healthier fats, and then things to kind of limit or avoid there. Stress definitely plays a role. So managing your stress, much easier said than done. This is just how stress affects the body. And then we always encourage you to start where you are and use what you have and do what you can, because again, it's just baby steps toward health. We would love for you to follow us on our social media. Miranda and Ashley and Carolyn are Wellness and Work Life. They are the dream team, and they do a fabulous job of updating all of this for us. So with that, I will see if there are any questions or comments. Thank you. I'm glad that was helpful. I'm glad you like the strategy. Is there any correction that can be done after complete blockage? Yes. So what they'll do is they'll go in and they'll usually put a stent in. If they can't place it in what we call the cath lab, kind of at the bedside in the clinic setting, they'll go into an OR, which is what they did with my mom, and they put stents in. So my mom has 2 stents. One was placed in the cath lab, one was placed in the OR. And those stents usually, have an expiration of 6 to 8 to 10 years, depending on the type of those used. But my mom is 17, 18 years out, and hers are still working great. So yeah, that's what you can do. And then from there on, you can use lifestyle choices to make better choices. And unfortunately, she had a strong genetic issue and a genetic variant that put her at risk because she really was controlling for all the other factors. She wasn't overweight. She, was really healthy, very active. About the only thing that she did was drink Dr. Peppers. She loved Dr. Peppers. But, sometimes we just have to control what we can. And unfortunately, that was not something that she could control. So cholesterol related to cardio fitness. Yeah, so you can deplete cholesterol and change cholesterol when you are over exercising. So yes, that can be a factor. That doesn't mean that you need to stop exercising. You just might need to change up what you're doing. Maybe do more walking and more like weight-based training, which is my favorite thing to do, versus like HIIT style cardio workouts and running. Running can be really hard on your body. I'm not a proponent of running, but that's just an Abbyism. That is not backed by research, but there is research that shows it cannot be healthy for some people. Do you know of any faculty staff services that are free at the recreation center or aquatic center? Most are not free, but we do have a discounted membership to those places, and they do a really great job of taking care of our faculty and staff. So definitely check those out, Ashley. All right. Any other questions, comments? Y'all are free to go. We're just over 1 o'clock, but I will stay on to answer questions or to take your comments and feedback. So the HDL, so go to that slide where it has the things about try this, try turmeric, curcumin, make sure that there's not a reason you shouldn't use those things. So definitely clear that with your healthcare provider because those can do different things in the body. But adding in fiber, adding in leafy greens, if there's not a contradiction, like, a contraindication, sometimes you can't do leafy greens if you're on certain meds. But I really suggest working with an RDN and your healthcare provider to figure out a plan for you, because I don't believe in there's healthy food for everybody. If you have GI issues or you have diverticulitis, like broccoli is healthy, but you can't eat broccoli because it's cruciferous vegetable. So it's really hard to tell you what to do in terms of like diet for your specific situation. I know people do that all the time, but I just don't believe that that's a good practice. But more omega-3s, more fiber, more fruits and vegetables, that will help. Light exercise. Marita, thanks for putting that in the chat about the membership to the rec center. And that's a really, really good price. And it includes the aquatic center. Perfect. Yes, definitely ask. And the thing is that some people are like medical professionals are probably going to tell you that they don't know much about it. There is research on turmeric and curcumin being helpful for some people, but also contraindicated for others. And so just know that your medical doctor may not know much about it, but you just want to make sure that they don't think of anything that is going to prohibit you from taking it. And then you can go over to the University Medical Center and you can ask for a registered dietitian, nutritionist consult. And we have some great folks over there who work with wellbeing, who can see you for usually around a $20 copay per visit. And that's been really helpful to me personally. Any other questions, comments, feedback, anything that we can address before we close out? Thank you so much for saying that, Ashley. I always like to hear that feedback because I want to share things that are helpful. And if my story can help you, then we want it to be helpful. Perfect. Well, thank y'all so much. Definitely check out the chat for the slides that Miranda sent you. If you can't get them downloaded from the slides, then you definitely can reach out to the Wellness Work Life office and they can send those to you via email. And as always, we thank y'all for joining us. We hope you have a great rest of your day. Focus on one thing at a time. And we hope you have a great weekend. Talk to y'all soon.